Hello, welcome to the therapy room with Shay. Today we're going to be talking to psychiatric nurse practitioner Miss Taneka Johnson. Tanika is new to the Center for Child Development, and we are so excited to introduce her to you and to be able to answer any questions that you may have surrounding medication. The therapy room is a place where we can speak to therapists about mental health needs and also learn different things on how to better take care of ourselves and navigate just life in general. So today I'm so excited to talk to Tanika, and she's going to share her experience, her expertise, and any questions that you may have. Please feel free to put them in the comments. Welcome to the therapy room, Tanika. Can you tell us a little bit about your journey into becoming a nurse practitioner and what led you to specialize in mental health and psychiatric medication?
Thank you for having me. First of all, it's an honor to be here. My background in behavioral health as a registered nurse. I quickly realized I was passionate about really understanding people, not just their symptoms, but actually what they're going through. That led me to become a psychiatric mental health nurse practitioner so I could play a bigger role in diagnosing, treating, and supporting patients.
Mhm.
I love being able to combine science with compassion and helping people, feel like themselves again.
Yeah, this is important,
It
right?
is.
It is
It is.
definitely important because I know as a therapist, a lot of my patients, that is one of their concerns. They don't want to
Mhm.
feel not like themselves, but they
Mhm.
do want to
Mhm.
feel some improvement. So I like the fact that you combine that. So for someone who may feel nervous or hesitant about taking medication
Mhm.
for their mental health, what would you want them to know to help ease their concerns?
Well, I hear that concern all the time, and it's completely valid. Medication isn't about changing who you are, it's about helping you feel more like yourself.
Hmm.
It's just one option, not something that's forced. So we take it at, your pace, talk through everything, make decisions together. So it's collaborative. So patients feel like they're participating in their care,
Hmm.
and they feel comfortable and in control.
Yeah, that's important. And I
Mhm.
guess that's part of building the trust with the patients,
Mhm.
especially when discussing something so personal. And psychiatric medication can be a little intimidating,
Intimidating,
you
yes.
know.
Mhm.
Um, so that's one way that you may build trust. Are there any other ways that you build trust with your patients when discussing medication?
So for me, it starts with listening, of
Hmm.
course, without judgment. I want patients to feel safe, being open and honest about what they're going through, what they're experiencing. And I'm very transparent about options, risk and benefits. I find that when patients feel heard and supported, trust naturally follows.
Yeah. And I'm sure that you may have had clients that you've seen that may not require medication from your expertise. So what does a collaborative relationship with your patients look like when it comes to deciding if
Mhm.
medication is the right step for their healing journey?
So it really depends on, what the patient, what their goals are,
Hmm.
um, how impaired their functioning is, and if that is something that can be worked out in therapy versus adding medication to the regimen. Because sometimes it's not always required. You know what I mean? It's not always, we don't just jump into medication. We want to start off with non-pharmacological interventions, of course, and go from there.
Okay, that's good to know. That's good
Mhm.
to know. So, anxiety and depression are
Mhm.
two of the most common challenges people face today, right? And I see it a lot in my practice. How do you help patients understand when medication might be helpful, and how do you support them through that decision without fear or stigma? Because that's a big thing that clients complain about, just the fear or the stigma of taking medication.
Yeah. So anxiety, depression, and depression is so prevalent. Especially, I saw an uptick, I believe, like when COVID came around.
Mm.
And that's when I really started noticing, like, wow, like people are really, this is a lot for us, for everybody. You know what I mean? And it can really affect your daily life, your mood, your sleep, your energy, your appetite, everything. Um, but medication can be helpful when symptoms are persistent and overwhelming, but it's never the only option.
Mm-hmm.
So I focus on educating patients, reducing stigma, and helping them feel more empowered to make the best decision for themselves.
Yeah, that's important.
Mhm.
And do you get, should patients already have like a work up already done, or is that something that you would send them for just to make sure that like their labs and with other medications that they may have? How does that work?
So it depends on their existing medical conditions. Like
Okay.
people may come, they may have a heart condition or, something like that. And, heart medication, like heart conditions can, if you have a patient who may have ADHD, for instance,
Mm-hmm.
and they want to possibly look into ADHD medication, we have to take a look at that because cardiac history and stimulant medication
Mm.
can sometimes be contraindicated. Depending on what the condition is, we may opt for a non-stimulant versus a stimulant.
Okay. Okay. That's good to know. That is
Mhm,
really good to know.
mhm,
So, can you
mhm.
tell the people what age range are you serving when it comes down to if someone wants to make an appointment with you, how can they reach out to you? What, yeah, the age range of people that you are seeing and taking on as new clients, and anything else you feel that we need to know when it comes down to take care of our mental health and with medication management.
Gotcha. So right now I am treating across the lifespan. My youngest client is 4 years old. He's so adorable. Um, but yeah, I am treating across the lifespan, so all ages.
Okay, perfect.
And at the end of the day, my goal is for every patient to feel heard and supported and empowered. Mental health is not a one size fit all, and the care that we provide is not a one size fit all. So no one should feel judged for needing help. And I'm here to walk alongside my patients, provide guidance, and help them find what truly works for them so they can live a healthier, more balanced life.
Absolutely. That is so true. How can people reach you, Tanika, if they want to set up an appointment?
People can reach me by calling the Center for Child Development. They will most likely speak to Rosalind, who can get them set up. And it's pretty easy, pretty seamless way
Yeah,
to make an appointment.
process. Yeah.
Mhm.
Yeah.
Yep.
And that number is 302-292-1334. Or you can simply just go to our website, the Center for Child Development.com, and you actually can find a page dedicated to Tanika there. And you can read a little bit more and see if medication management is for you. So, Tanika, thank you so much for taking time to talk with
No
us. And
problem. It was my pleasure.
yeah, we would love
Mhm.
to have you back to discuss different, different diagnoses like
Mhm.
ADHD
Mhm.
and what type of medications, that may be, prescribed for someone that has
Yep.
that.
Mhm.
Um, Maybe talk a little bit about side effects and those type of things, because I think it's important that the community is educated on medication and if it's the right fit, because it's such a stigma, right?
It is.
When we want to normalize that, just like we've been normalizing mental health and going to therapy, we want to make sure we
Yes.
normalize, medication if it's
If
absolutely
it's needed.
necessary. Yeah,
Mhm.
yeah,
Absolutely.
yeah.
Well, I would
Perfect.
love to come back and discuss those things.
Okay, perfect. Thank you so much.
You're
So if
welcome.
you guys are interested in making an appointment with Tanika to learn more, just reach out. You don't necessarily have to be seeing a therapist here at Center for Child Development or Delaware Center for Counseling and Wellness. If you just want to meet with her to talk about medication management, that is perfectly fine. Or you can do both. You can get a therapist here as well as meet with Taneka. So thank you guys for tuning in to another episode of the Therapy Room. Again, if you want more information, please go to our website or reach out at 302-292-1334. Taneka, thank you again for your time. And
You're
until
welcome.
next time, guys, have a wonderful and blessed week.
Bye bye.